Good day and welcome to today's webinar, Accountability and Education of Non-Healthcare Personnel, Best Practices and Guidance, presented by the Athletic Healthcare Administrator Association. My name is Dr. Jim Borchers. I'm the President and CEO of the U.S. Council for Athletes Health, the parent organization for the AHAA. Our panel of sports medicine and legal experts are prepared to discuss how we as healthcare professionals can best work with administration, team staff, coaches, and other non-medical athletics personnel to create and enforce collaborative, athlete-focused policies and procedures regarding health and safety. Before I introduce our wonderful panelists here today, I need to review just a few housekeeping items with you. Your camera and microphone will not be available during the presentation. However, we encourage you to use the Q&A function to submit questions for our panelists. We'll be answering those questions in the Q&A function during the webinar today, and a transcript will be made available following the event. For athletic trainers looking for continuing education credit, a certificate will be sent via email after the course. An email will also be sent to all attendees with a course evaluation survey. We appreciate your feedback from everyone, and it should be completed if you need to claim your continuing education credits. Now I'm honored to introduce you to our panelists for our discussion today. First, I'd like to introduce Dr. Chad Asplund, a repeat panelist for us, but an expert in many of these different areas. Chad is a sports medicine physician and professor of family medicine and orthopedics at Mayo Clinic in Rochester, Minnesota, and serves as an associate for the U.S. Council for Athletes Health. He's also the past president of the American Medical Society for Sports Medicine and a team physician for the U.S. Ski Team, USA Basketball, and USA Triathlon. Angie Beisner is with us today as well, a senior director at USCAH, collaborating with our valued partners and an experienced resource for innovative solutions, first-class resources, and collaboration. She spent more than 2 decades as a collegiate athletic trainer, previously serving as the head athletic trainer at Ohio State University. Really excited today to welcome Murphy Grant. Murphy's well known to many throughout collegiate sports medicine as not only an expert in his field, but as an excellent colleague and a valued resource. Murphy is a 20-year veteran in collegiate sports medicine, most recently serving as a senior associate athletic director and inaugural athletics healthcare administrator at Wake Forest University. He's also served a number of other positions, including being the past executive chair of the NATA's Intercollegiate Council for Sports Medicine and the owner of Grant Sports Performance and Therapy. Our other panelist that'll be joining us here shortly and was going to be delayed just a little bit is Jeff White. Jeff White serves as the vice president and in-house legal counsel for the NJCAA National Office. Jeff works with the association staff, region leaders, and board of regent members to oversee all risk management and legal matters, including Title IX compliance, association policies and procedures, legislative impact, and contract reviews. We hope Jeff will be able to join us here shortly as he was coming from another meeting. As I mentioned, my name is Jim Borchers, and I'm going to be the moderator today as we discuss accountability and education of non-healthcare personnel. In many of our previous webinars, we've had a lot of focus on the responsibilities of healthcare personnel, but it's really important as we think about athletics as a whole, but certainly collegiate athletics, that we think about how our non-healthcare personnel are required to associate with all the policies, procedures, and requirements for health, safety, and welfare of athletes, and especially student athletes. I think that one of the things that the panelists and I were discussing in preparation for this webinar is how organizations and athletic organizations are set up in a way to be able to accomplish this and what some of those challenges are. But I think it's also a question of risk and liability, which we're going to discuss today as well, because as we know, this can be certainly an area where, if not done appropriately, can be a problem for a lot of organizations. So I thought I'd start today, and Murphy, I hope you don't mind that I'm going to come to you first with your experience, and certainly to get some comments from you, and then probably go to Angie, because both of you have lived in this world as not only athletic trainers, but also as liaisons or working with administration when you think about these sorts of requirements. And so we think about things like the inter-association recommendations from the NCAA for the prevention of catastrophic injury and sudden death in athletes. we think about other recommendations that have come from organizations like AMSSM, the NATA, AOSSM, and many other organizations that have endorsed those recommendations and other recommendations for best practices. Can you speak a little bit, Murphy, on some of the challenges and also some of the, just requirements when you think about this from seats that you've held when we think about these non-athletic personnel?
Right. Well, first off, Dr. Borcher, thank you so much, and want to thank you, USCAH, for having me on. I think this is a very important conversation, and I'm glad to be a part of this. When you think about athletic training and being the boots on the ground and the healthcare of the student athlete, along with the team physicians, that is what we're doing every single day. It is very important to us. We know that it's very important to the success of teams, but more or less those individuals that you hope to live healthy, prosperous lives after they complete their years of eligibility. So it's something that we do day in and day out. Now, moving from the administrative piece to it, and making sure that everyone within the athletic department understands that everyone truly plays a role in the health and safety of the student athlete. And as the athletic trainers, directors of sports medicine, team physicians continue to grow within those athletic departments, it's important that relationships are definitely developed with the senior level administration and the athletic directors themselves on what that truly means. You see around the country that several institutions talk about health and safety being the #1 priority. And if that is the case, then again, as I mentioned, the directors of the directors of sports medicine and team physicians definitely need to build that relationship. And as we continue to go, we can discuss a little bit more on the relationship building piece.
Angie, some comments maybe from your seat and your experience. You've had a lot of experience in this seat in working with those non-healthcare personnel and these sorts of requirements and best practices.
Yeah, thanks. I appreciate everybody having me today, and welcome to all the guests to today's webinar. I think that one of the challenges we have right now is that it's time for us to have an educational shift across all areas of athletics. As athletic trainers, if an athletic trainer is on a field, administrators, coaches, staff feel like they're safe and they're exempt from all responsibility. When in reality, the health and safety of student athletes is really every person's responsibility. So the antiquated thinking that we had 20 years ago, as long as I have an AT out there, nothing bad's going to happen. And if there is something bad that's going to happen, they're going to be responding. We won't have any risk because we have an athletic trainer there. That's kind of the old way of thinking. At this point, what we've seen, throughout the country and in many legal cases is that every person's responsible for the health and safety of student athletes. So a lot of this boils down to having those conversations now that we are in a new era where every person that interacts with the student athlete is ultimately responsible for the health and safety, not just the athletic trainer or the team physician.
Yeah, it's really a really good point, Angie, is that there's so much out there in best practices about responsibilities of non-healthcare personnel and what they should be doing, educated on. I think it's something that maybe not everyone's aware of. Maybe there's a recognition factor, there's an awareness factor, but certainly it can be a challenge. I think I'm going to go to our to Jeff White here next. Jeff, good to see you today, and thank you so much for joining us, Jeff. As you put your legal hat on and also your administrative hat on from the positions and the seats that you sit in, and thinking about how your institutions, in the 2-year space are resourced, but also the requirements. Can you speak a little bit about, I think we all think about the maybe the Power 5 or how, but this really trickles down to so many different levels of athletics. And from your seat, the challenge or the responsibility for these non-athletic healthcare personnel and their responsibilities at your seat.
Sure. Thank you, Dr. Borchers, and hello, everyone. Thanks for allowing me to be part of this esteemed panel. I think the first thing I'd say is that what Angela shared there is spot on. And what's interesting is the responsibilities. Not only are they you're no longer covered by just having an athletic trainer. There's evaluation and analysis of everything that happens before, during, and after practices, before, during, and after games, the whole 9 yards. In the off season, conditioning programs, every component, every aspect of your athletics program is potentially, I don't want to say at risk or a target, but that's really oftentimes the way it's viewed. And so, Dr. Borchers, as you just said, the expectations really are no different for the 2-year space than they are for the 5-year or the 4-year space. But the difference is, obviously that they can be resourced much differently. So all that to say, one of the things that we work very hard to do is to find cost-effective and with a priority, a true focus and priority on safety, student safety, to meet the needs of all the parties involved. And of course, that can be a real challenge, but it does require there's no one size fits all approach or solution that's going to fix that, right? It's a combination of medical resources and training and certifications, preventative measures that you're taking to understand what your responsibilities are, the right kinds of partnerships locally. Oftentimes, in my experience, 2-year schools or community colleges are going to rely more heavily on partnerships than typically a 4-year school would, because the 4-year school probably has a hospital on site, whereas the 2-year school doesn't. And so just identifying what your practices are and making sure you're committed to that.
I think